So these are the principles of this SUS, the unique system of health in Brazil. Next. It's a national system. That's another thing that's interesting to understand in the context of India. It's a national system with a national policy. The national government is responsible to make the warranties of the right of the people everywhere in the country. That's very important, because then the national government will be responsible for the equity-oriented initiatives, no? To reduce the gaps. Because, of course, there are some states with better structure than others, with better health results than others. But this unique national health system, with the state, the national state, responsible for to ensure to assure this social contract of rights, they will have, in our experience, a protagonism of the province and the local governments in terms of the management and the provision of service. Okay? Because it's extremely important to have this capacity. So this is the reason why our transfer of money from the national government to the local governments is tremendously important. Because, of course, our tax system is 65% national system. And the other 35 are distributed in the states and cities. So it's necessary that the national government will redistribute that, trying to be equity-oriented, no? to do compensatory accountability on that, and at the same time to promote the idea that the local governments and the state governments are responsible as well. And they need to make accountability to the national government in terms of the national policies. No? This is very important, because then when a citizen feels that the health is not adequate in a city, they can ask for the state government and the national government for intervention. Okay? That's very important. And finally, please, go ahead. It's only to give a very important note about the participatory system. When we conceived our national health system, we were very much concerned about the power concentration of the national state in Brazil. We had a quite large history of centralized government, no? So we promoted this decentralization where the local governments would have more power, because we would like that people could access to the decision-making at the local government space, and then to promote this projection of their own opinions and needs to the department and national government. So we established a national social participation system. At each city, we have a city council of health. At each state, a state council of health, and then a national one. 50% as a minimum of the members of the councils are elected by communities, are users, no? The other half of the councils are composed by one-third by health professionals representatives, one-third by governments, and one-third by health providers. Okay? So the majority are the users, I mean, the citizens. And those councils, they have decision-making power. So they approve the plans, the health plans, the health budgets, and they need to approve the accountability of the authority corresponding to them. If they don't approve plans, budget, and accountability, the authority is blocked. In the case of a city, many examples where the health council didn't agree with the accountability or whatever, and it blocked the transfer of research from the national government and established automatically a mission that will review the procedures of the local government. No? So it's a real power process. I mean, in the sense that for us, since the beginning, the idea to have social participation is connected with a decision-making process, a real one. The maximum example of that is that our former Minister of Health presented 2 or 3 national initiatives of the government, and the National Health Council blocked those initiatives. And there was no way to approve that, no? Because the council considered that the initiatives were against the nature of the universal system, whatever. So this is something